Hello everyone, my name is Vanessa Davila and today I will be doing shingles, and this is a little image right here of those shingles blisters. And let's talk about what shingles is. So shingles is the common name, but the formal name is herpes zoster virus. And herpes zoster virus is actually caused by varicella zoster virus. And you may ask, what's the correlation between those two? So what happens is you first have to get chickenpox or the chickenpox vaccine in order to get shingles. You can't just have shingles and transfer it to someone else. You have to have that varicella zoster virus that is dormant in your dorsal root ganglia in your spine first in order to have it reactivate due to, say, stress, extreme amounts of stress, or anything that suppresses or weakens your immune system, such as undergoing chemotherapy. And that reactivates the varicella zoster virus to become herpes zoster virus, which is shingles. A lot of the times we see this reactivation in ages 50 and up, and that's just because a lot of the time as you get older, your immune system is more weakened. So that's why there's a lot less cases of individuals with shingles who are younger than 50. Okay, let's talk about signs and symptoms. So we can see here rash is number one, and rash is what's shown on these images. So these are the locations where you would most likely see the varicella zoster virus appear in the shingles blister rash form. And it appears in stripe-like patterns, and it's going to appear on either your right side or your left side, and it's going to appear either on your face or on your torso, just like this. And then you can also experience fever, headache, chills, and an upset stomach. So let's talk a little bit more about that rash. So rashes typically blister over or scab over within 7 to 10 days, and then it fully clears up within 2 to 4 weeks. Now, once that scab has occurred and it's completely scabbed over, you're no longer contagious to any other individuals. And also, when you have the varicella zoster virus but no physical skin lesions or rash or blisters have occurred on your skin yet, you're also not contagious to others just quite yet. It's only when you have those skin blisters on you where you can definitely spread that varicella zoster virus. Okay, let's talk about a diagnosis. So when you go to your physician and you have that shingles rash, it's very distinctive in that stripe-like pattern, and then you can also tell them your signs and symptoms, which usually is a dead giveaway that it's shingles and they'll know it. However, just to be very certain, they can do a PCR test, which is where they'll take a swab and they'll swab that skin lesion, that rash, and they'll be able to detect if varicella zoster virus DNA is in that. Also, let's say you don't have that rash yet, because that rash does take a few days to appear after you've gotten the varicella zoster virus reactivated in your body. So a lot of the times you can get misdiagnosed because the other symptoms such as fever, headache, and chills could be associated with something else like the flu. So that could be a misdiagnosis. So the PCR test, they can swab your saliva. Although it's less effective, it's still possible to detect that varicella zoster virus. Okay, let's talk about transmission. So transmission here, we can see it's person to person. So there's no animal or insect hosts or carriers whatsoever. It's just a human virus. There's two ways to get the infection or the virus spread to others, and that's through direct contact or aerosol. So direct contact is if you directly touch the skin lesion and the blisters of somebody who has shingles, and that can give you the varicella zoster virus. Also, if you're very close to that rash and those blisters, that varicella zoster virus can easily enter your respiratory tract and replicate in your lymph nodes. Also, if somebody who has the varicella zoster virus coughs, that's aerosolized as well. Let's talk about this right here. So what does typically one episode mean? So usually when you experience shingles, it's only once in your lifetime. if you're a healthy individual. Sometimes you can have or you can experience a shingles outbreak more than once in your lifetime, but that's usually more common in people who are immunocompromised or have an extremely weak immune system. All right, so the incubation period is between 14 to 16 days. Okay, so let's go on to rates and trends. So this graph right here is from the CDC website, and we can see it starts youngest to oldest as we go up. So youngest group right here is in blue, and the oldest is 70 plus age group, which is in green. So we see that shingles rates in adults 30 and older since 1998 to 2016. So we can see based on the data here that obviously the older you are, the more cases. And that's what we're going to get into right here. So with increased age, you have an increased risk for shingles. So we see that out of every 1 out of 3 individuals get shingles in America. We also have 1 million cases per year, as well as 4 cases per 1,000 individuals get shingles annually. And then when you reach that 60 age group and up, you have 1 case per 100 people. Out of those cases, 1 to 4% of individuals are hospitalized because of shingles. And within that 1 to 4% of individuals, you have 30% of those individuals who are immunocompromised. We have less than 100 deaths annually as well because of shingles. So let's get into the effects of shingles. So after shingles. So once you've recovered from shingles, you can experience these things. So PHN, what is PHN? It's post-therapeutic neuralgia, which is a long-term nerve pain. So long-term, what does that mean? It can be anywhere from a few months to years. It depends on the person. And the pain is often excruciating and it's debilitating. And a lot of the times people aren't able to do simple daily tasks because of that. We have that 10 to 18% of people who have shingles will get PHN after that shingles episode. And just like you have an increased risk to get shingles with age, as you get older, you have an increased risk to get PHN after you've had shingles. A lot of the time, it's pretty rare to see PHN after shingles in individuals who are under 40. Let's talk about some secondary bacterial infections. So what I mean by that is we have a commensalism type of relationship with Staphylococcus and Streptococcus on our skin. But as soon as you have those open lesions, or in this case, those blisters due to the rash, you're going to have an increased risk of getting a parasitic relationship with that Staphylococcus and the Streptococcus because they're going to enter your bloodstream and that could cause death. And that's serious. So you can also get pneumonia. Right here in this image right here, there's a patient who has herpes zoster virus, and there's a lot of mucus and buildup because of that. You can also get brain inflammation, also known as encephalitis. You can get hearing problems. You can also get lifetime immunity from shingles. So when you have different areas, you can see it's definitely affecting different areas in the body. So shingles, if it's on your face, you have an increased risk of that brain inflammation, the hearing problems, even vision loss. When it's closer to your torso, you have that increased risk of pneumonia. Also, it's unpredictable because shingles can disperse throughout your body. This image right here is of a patient who has herpes zoster virus, and they have the multifocal vasculopathy version, which affects small and medium-sized cerebral vessels. And this patient has infarctions, which is tissue death in their brain because of that. Let's talk about spread prevention. So we have cover that rash. You don't want to spread it to other individuals. You don't want to aerosolize it even more than it needs to be. You want to wash your hands frequently. You don't want to touch or scratch at those open lesions on the skin. You also want to avoid certain individuals, so women who are pregnant and they've never had chicken pox before. You also want to avoid premature or low birth weight infants. You want to avoid people who their immune systems are very weak, such as people who have to take immunosuppressants. people who are having to go undergo chemotherapy, also people who are having organ transplants, and individuals who have had HIV. Treatments. So there's no cure for shingles. These things are really just to aid in the healing process of shingles. So antiviral drugs that your physician can prescribe you is acyclovir, valacyclovir, and famciclovir. And these are antiviral drugs that just help in speeding up the healing process, and they also prevent any possible complications that can come about from shingles. So over-the-counter aids to help with pain could be wet compresses, calamine lotion. You can also use a colloidal oatmeal bath to help with itching. The vaccine is Shingles. It's in 2 dosages, and it's a recombinant roster vaccination for individuals 50 and older. It has a 90% effective rate. The effectiveness does decrease as you get older. 50 to 69 years of age, you have a 97% effective rate. 70 years of age, 91. 70 years and older, you have an 85% effective rate. Individuals who should not get the vaccination are individuals who are allergic to anything that makes up the vaccination or who've had an allergic reaction after the first dose. Anyone who's had a negative test for varicella-zoster virus immunity, anyone who currently has shingles should not get the vaccination, and anyone who's pregnant and breastfeeding. So let's talk about some short-term side effects. These usually last between 2 to 3 days. You can get a sore arm where you got the vaccination. You can have redness and swelling. You can get tired. You can get muscle pain, headaches, shivering, fever, stomach pain, and nausea. Let's get into the history. So, earliest reports is by an encyclopedist named Celsus in 25 BC to 50 AD, who coined the phrase herpes zoster. In 1888, we have James von Boeke, and he noticed that children who've never had chickenpox before were getting chickenpox when they encountered patients with shingles. So he made that correlation between the relationship of chickenpox and shingles. And all right, so in 1954, Thomas Huckelweller, right here, this is a picture of him. He used a cell culture to isolate the varicella-zoster virus from a vesicular fluid with a patient who had varicella. And then in 1965, Edgar Hope Simpson, he hypothesized that herpes zoster was due to the reactivation of the dormant varicella-zoster virus. And in 1986, we see DNA sequence. So that's when the DNA sequence of the varicella-zoster virus was discovered. In 2006, we have the first vaccination approved in the US for shingles. And then in 2017, we have the FDA's approval of Shingles. All right, so these are my resources, and I hope you all enjoyed. Stay safe.